Hi, I'm Gregory, licensed marriage and family therapist and the owner of Johns Creek and Alpharetta Counseling. Today I'm going to talk about play therapy, what it is, how it works, and what you can expect from a play therapist. Let's dive in. So to start with, what is play therapy? Play therapy, in its most simplest form, is a form of counseling for children. A question I get a lot in the intake process with parents is, are you just going to play with my child for an hour? Well, essentially, yes, but it's going to be therapeutic play. So let me explain what that means. Children use play to express themselves. Younger children have a limited vocabulary to express what they've gone through or how they feel. Play also relaxes children. It allows them to feel comfortable, and so they can be open to express whatever they're going through or to really get to the root of why they may be misbehaving. As counselors who have been trained to offer play therapy, we know how to access children's emotions through play, help them regulate their emotions through play. And as we are playing, as we are connecting, we start getting down to the root of why they are there. It may take a few sessions, especially for them to relax, to know I can be open here. But we eventually do get there and we're able to work through it, and the child's able to process it through their natural means. Can you imagine a child walking into that room, expressing that embarrassing moment verbally, knowing what to say, knowing how to say it, when we ourselves, if we think about it, it would be hard for us as adults. And so that's the power of play therapy. And that's the power of how we're able to reach to children and help them through their natural element. So yes, we are playing with your child for an hour. And it's a lot of fun too. The child usually walks out, just had a great time. Sometimes it's hard for the child to leave the therapy room. But all the while, what we call is the child's been working therapeutically through their play. At JCAC, what you can expect from us getting started with one of our play therapists, we keep a really open dialogue with parents. The younger the child, the more open it is. The older the child, the more privacy they have. But parents will know the themes of their play, what we're working towards, whether it's depression, anxiety, coping skills, how you can best support them at home, and what their treatment plan is. What goals are we working towards together? And you'll be active in creating that treatment plan for your child. You'll be in tune with the process. You'll be knowing what we're working on and when we're working on it. However, small little details of how your child may feel about their Aunt Sue, well, that's their private space to process. And so you'll know the general themes, you'll know what direction we're going in, and you'll be part of that direction as well. What we are also able to do is offer you support as a parent. Parenting children who are going through something is very difficult because it's two pieces. One, their emotions are bigger, so it's harder to manage at home. Also, your heart's breaking because you know they're struggling. So there's a two-pronged piece here. And it also could be triggering to you if it's something related to something you've been struggling with as well. So we're here to also reach out, support you in the way we can, help you create structure and boundaries at home, but also help you take care of yourself so that you're strong for your child. The old cliche of putting on your mask before your child's. What you can expect is in the first session, if the child's under 10, it'll be one-on-one with you and your spouse to process what your child's been going through, what you hope to change. That way you can be open and candid and express everything you need to. For children 10 and under, the next two sessions are going to be one-on-one with the counselor. This is where we explore how the child sees their world, how they see themselves, how they regulate, how they're able to stay focused and pay attention, and their ability to access and communicate emotion. If the child is very muted at first, we know it's going to take a little while for them to break open and start expressing. Or if they're very expressive at first, we know we can get to things pretty quickly. Then the fourth session is a family session. This is one of my favorite sessions where we do a little fun play therapy activities together as a family, so we see how your child interacts with you and their siblings, so we can get kind of a picture of what you've described at your home. Also, we create some challenges to see how the child responds to these challenges and how they're able to regulate or not regulate through those moments. After those first four sessions, we're able to give you really solid feedback of what we see going on and how we feel we can best help. In some situations, a play therapist isn't what you need. You may need OT, or you may need some kind of behavioral support, or you may need a psychologist evaluation. We're able to recommend those types of things if we're not the right fit, or we're able to collaboratively work with someone like that so that we are working together on the same team to achieve goals. If you're looking for a play therapist for your child, first we have a video here of how to find a counselor online. That goes through some of the basics of how to search for a counselor, but more specifically with a play therapist, if you're looking for one, you want to see, do they have the initials RPT behind their name? That means registered play therapist. This means that they have worked to earn that designation. They have the training, they have the supervision. A lot of counselors are working towards earning those letters. It takes about 3 or more years to get there. And so you can either look for those initials or in a phone call ask, are you working towards RPT? How far into it are you? How much training do you have? And a really key question is, how much of your caseload is children, and then children who are experiencing what you are? So let's say your child's going through your divorce. How many children who are going through a divorce have you worked with? So that way you really know, does this counselor have experience working with something my child is going through? And another important thing when you're looking for a play therapist is, how do you feel talking to them on the phone? Do you feel like I would be able to trust this person with my child? Their demeanor, their personality, do you feel like your child's personality would fit well with theirs? More of a direct, more of a soft. It depends on the child and it depends on the counselor, but the goodness of fit is very, very important. A therapeutic playroom has a wide range of toys to offer. So if you're calling around to find a play therapist for your child, an important question to ask is what kind of tools in the playroom they have for your child. One important one is a sand tray with lots of different sand figures to choose from. Another is art supplies and art materials to be able to express themselves through color, through imagery. Also, different ways of acting out or playing out. It's also important to note the difference between what we do and what a psychologist does. If you're wanting to know the difference between a counselor, psychologist, and psychiatrist, we have a video right here for that. But a psychologist does a battery of testing with children, and they can give you concrete evaluation of diagnosis and recommendations. As a counselor offering play therapy, we do playful assessments where we play with your child to measure these different things, and we're able to give generalizations of, we see some anxiety, here's a plan to work on anxiety. However, having something tangible like a report for school, that's not something in our wheelhouse, and we would refer out for that. I hope that answers any questions you have about play therapy. If there's something we didn't cover you want to know more about, please drop that question in the comments or reach out to us on our direct intake line. That information is down below. If you're interested in following up with us about play therapy, down below you'll see links to our website to learn more and to schedule your first appointment. We invite you to join our community by hitting the subscribe button to see more videos come out and to explore other topics on counseling and mental health. Thank you, and I look forward to seeing you in our next video.